Assalamu alaikum. Today I would like to discuss about a very high-level topic called abortion or miscarriage. There are certain types, but these two is very important. Spontaneous abortion means termination of the pregnancy or loss of fetus before 20 weeks, and stillbirth is after 20 weeks. So spontaneous abortion is before 20 weeks and stillbirth or intrauterine fetal demise is after 20 is very high yield. So stillbirth after. These are the types of the miscarriages or the abortion. This is missed abortion. That means three things we need to consider in case of abortion: vaginal bleeding, cervical loss, and cardiac. So VCC, vaginal bleeding. In first missed in missed abortion, there is no vaginal bleeding. In missed abortion, cervical os is closed. Cervical os is closed, and there is no fetal cardiac activity or empty sac. No fetal cardiac activity or empty sac. This is missed. For threatened, pregnancy is threatening, inevitable. It will fall down in no time. Inevitable. Okay, threatening. Again, vaginal bleeding is present. Cervical os is closed. Vaginal bleeding is present. Cervical os is closed. Fetal cardiac activity is present. Threatened. In inevitable. In inevitable, vaginal bleeding is again present. Vaginal bleeding is again present. Vaginal bleeding. Okay, so for inevitable, that means it will today or tomorrow will come out. That means vaginal bleeding present, dilated cervical loss, very high yield. It is not closed cervical loss, it is dilated cervical loss, and products of the conception may be seen or felt or above the cervical os. Product of conception may be seen. Products of conception. So products of conception may be seen or felt at or above the cervical os. Then it is incomplete. In incomplete look, vaginal bleeding is present. Cervical os is dilated, and some products of the conception is expelled and some remain. Some expelled, some remain. And in here all the products of conception comes out. Vaginal bleeding is present and there is closed as the products is coming down. Complete closed cervical os. Complete closed cervical os. Okay. Okay, missed abortion. In missed abortion there is no vaginal bleeding, closed cervical os, and no fetal or cardiac activity. In missed abortion, patients are typically asymptomatic and have no pregnancy symptoms, have loss of pregnancy symptoms, nausea, breast tenderness with decreasing beta ECG, nausea or breast tenderness with decreasing beta ECG level, ultrasound findings, no cardiac activity, empty gestational sac with fetal pole, complete abortion, unilateral ovarian cyst, corpus luteum, and some fluid in the pelvis. Beta ECG can take 6 weeks to go. Beta ECG can take 6 weeks to go undetectable. Complete abortion. Beta ECG takes 6 weeks to undetectable. So spontaneous abortion. Spontaneous abortion is pregnancy loss less than 20 weeks. Pregnancy loss less than 20 weeks. Advanced maternal age, substance use disorder, and previous spontaneous abortion. Treatment options: expectant, medical induction, misoprostol, suction curettage, if infection or hemodynamic instability. If infection or hemodynamic instability. Additional management: raw immunoglobulin and pathologic examination. Raw immunoglobulin and pathologic examination. Complication is hemorrhage, retained product of conception, septic abortion, uterine perforation, and intrauterine adhesion. These are the complications like septic abortion. Spontaneous abortion can cause septic abortion. Additional management: raw immunoglobulin. In here, spontaneous abortion expected management should be done. Misoprostol for medical induction. Spontaneous abortion is often associated with chromosomal trisomies like trisomy 16. Septic abortion, written product of conception, elective abortion with non-sterile technique, missed or incomplete abortion. There may be fever, chills, abdominal pain, sanguinopurulent, vaginal discharge, tender uterus, dilated cervix, tender uterus, dilated cervix, pelvic ultrasound, written product of conception, thick endometrial stripe, IV fluid, broad spectrum antibiotics, suction curatives, IV fluid, broad spectrum antibiotic, and suction curatives. What is the recommended treatment for patient with septic abortion? Recommended treatment for broad spectrum antibiotic and septic suction, and antibiotic. Medical emergency urgent treatment is required to reduce the risk of sepsis. These are the what are the causes of recurrent pregnancy loss? This may be structural, it may be fibroid or polyp, chromosomal, maybe aneuploidy, mosaicism, immunologic like hypercoagulability disorder, antiphospholipid antibody syndrome, autoimmune intolerance. There may be endocrine cause, thyroid disease, diabetes, polycystic ovarian syndrome, hyperprolactinemia, and advanced maternal age, celiac disease. Celiac disease is one of the cause of recurrent pregnancy loss, and defective endometrial receptivity and decreased ovarian reserve. Okay, let's do some questions regarding abortion. Okay, start with this. Okay, look at this question. Bedside translation ultrasound show 9 week size of fetus, and they are in the lower uterine segment and no cardiac activity. So 9 week size of fetus and no cardiac activity. IV fluid is begin. Okay, look in here. There is active bleeding and open cervical os. Cervical os is opened in inevitable abortion. We know that, uh, and there is no fetal, no cardiac activity, no cardiac activity. Cervical os is open, so looks like spontaneous abortion. So spontaneous abortion, suction curettage should be done, and looks like it is inevitable abortion. So pregnancy loss less than 20 weeks. Spontaneous abortion treatment is expectant, medical induction, and suction curettage if infection or hemodynamic instability. In here, patient's BP is 90/65, so there is hemodynamic instability. So management of this inevitable abortion: if the patient is hemodynamic stability dependent on the patient's preference and hemodynamic instability. Surgical management: suction curettage is indicated in symptomatic dizziness on starting and hemodynamic unstable patient like hypotensive tachycardic patient, uh, and patients with anemia from acute blood loss. Suction curettage to remove the placenta. This is a way of suction curettage to remove suction curettage removes the retained product of the conception, allows the uterus to fully contract and open uterine vessel. So always look at the stem. In the stem, what we found, there is lower abdomen 10 weeks, lower abdominal pain, normal. A week ago ultrasound is normal fetal heart rate, but now BP is low. Uh, there is open cervical os, and now there is no fetal cardiac activity. So looks like spontaneous abortion, looks like inevitable abortion. If we look at this stem, what happens in here? The patient's blood pressure 120 by 70. Oh, okay. She comes due to lower abdominal pain and vaginal bleeding. So she comes lower abdominal pain and vaginal bleeding, pelvic closed cervix, and small amount of blood pulled into the vaginal wall. Beta ECG is negative, so she is pregnant. So maybe abortion, maybe complete abortion, because beta ECG is high. There is closed cervix. There is closed cervix, and some products are pulled in the vaginal wall. Okay, incomplete vaginal bleeding, closed cervical os, and products of conception completely expelled up. So in here, product of conception completely expelled off. That's why. And transvaginal ultrasound, no intrauterine gestational sac, looks like complete abortion. Look at this picture. This is complete. There is vaginal bleeding, closed cervical os, and product of conception completely expelled. And these symptoms worsens with until the product of conception describes as solid sac-like bloody purple to white mass are expelled, and the symptoms lessen and resolve. There is closed cervix. Ultrasound show empty uterus. That's why it is complete. Okay, look at this question. In this, there is 7 weeks of gestation brought to the emergency department due to again 7 weeks vaginal bleeding, lower abdominal pain. Now what we will see: pelvic examination, blood clot in the vaginal and active bleeding from dilated cervix, bimanual 6 weeks size, tender ultrasound show a gestational sac in the lower uterine segment and a simple cyst. So gestational sac is present. What about the cervix? Dilated cervix. So there is vaginal bleeding 1 point. There is cervix is dilated. So it is either it is either inevitable. It is either inevitable, and there is ultrasound shows a gestational sac in the lower segment. So it looks like inevitable. There is vaginal bleeding, dilated cervical os, and products of conception may be seen or felt above the cervical os. So gestational sac in the lower uterine segment. So looks like inevitable abortion. In threatened abortion, there is vaginal bleeding, but cervical os is closed. So you have to look at the cervical os. Okay, now this patient again uh, fever, heavy bleeding, 8 weeks of gestation. Okay, now look at the cervical os. There is purulent bloody discharge from cervical os as purulent discharge, and what there is fever. It may be septic abortion. Suction curate should be done. Septic abortion because fever is high, and there is transvaginal ultrasound show small amount of free fluid in the pelvis. So looks like septic abortion. With septic abortion, IV antibiotic, a broad spectrum antibiotic, fluid, and suction curettage. Okay, the last question of these abortion? Okay, if we look at this question, okay, the vaginal bleeding, there is small amount of red blood cell coming from the cervix. Cervix is closed. So cervix is closed, uterus is 6 weeks sized retroverted. So cervix closed, uterus, a pelvic ultrasound show an endometrium measuring to a simple cyst in the adnexia and a small amount of free fluid in the cul-de-sac. Okay, maternal blood group is Rh negative, so you have to give anti-D immunoglobulin. So it is spontaneous abortion, less than 20 weeks of gestation. Patient with spontaneous abortion are evaluated hemodynamic status, pelvic examination, signs of infection, types of abortion, location on the product of the conception, and maternal bleeding type. If maternal bleeding type is Rh negative, if maternal bleeding type is performed because obstetric bleeding include spontaneous abortion at a later gestational age, 13 weeks in this patient can result in maternal fetal hemorrhage. Includes these introduce risk of Rh alloimmunization in Rh negative patient. So this hemodynamic is stable, no retained product of conception, no signs of infection, uncomplicated and complete. Spontaneous abortion is managed expectantly. Anti-immunoglobulin is required for because the Rh negative and the fetal blood type is unknown. Okay, that's all about the abortion. Now, can you see this video?
Hypertrophic cardiomyopathy.
This is hypertrophic cardiomyopathy. In hypertrophic cardiomyopathy, there is normal septum,
Hypertrophic cardiomyopathy is characterized by enlargement of
normal
the
septum, but in
interventricular
hypertrophy,
septum.
there is enlarged
The enlarged
interventricular septum
septum
and
restricts
outflow
flow
is
through the left
limited.
ventricular outflow tract. Outflow obstruction
So
varies
there
with
are some
left ventricular
maneuvers
volume.
for that affects the obstruction.
Standing causes blood to pool in the legs and reduces venous return to the heart.
Standing decreases left ventricular volume, worsens obstruction, and
Left
accentuates
ventricular
murmur.
volume is decreased, which worsens the obstruction and accentuates the murmur. In severe cases, systolic anterior motion of the mitral valve leaflets may further exacerbate the outflow tract obstruction. Other maneuvers that
Okay,
decrease left
these
ventricular
two
volume,
standing
such as
valsalva
Valsalva
increases
strain
the
phase,
murmur.
will also accentuate the murmur. Squatting increases afterload by compressing the vasculature and causes the pooled blood in the legs to
Squatting
mobilize. There is an increase in venous return to the heart.
increases left
Left
ventricular
ventricular
volume
volume is
and
increased,
lessens
which lessens
obstruction,
the
increases
obstruction and
murmur.
decreases the murmur. Supine leg raise and hand grip also
So
increase left
SS
ventricular volume and decrease the murmur.
squatting, leg raise, and hand grip increases murmur. Okay, okay, okay. That's all for today.